All right. So we're going to COVID, right?
Let's go to COVID. What do we
All
got?
right. We got some really great news. COVID cases are up 80% across the world. Number of new COVID cases reported worldwide rose by 80% in the last month. Days after designating a new variant of interest, which was the Eris variant, which we sort of aren't hearing so much about right now, but they are talking about BA286, I think. COVID
I think
numbers.
what they know is that it's more contagious, so that's good. That's all I got.
It's mild. They said it's even more mild than Omicron. I can't believe they're rolling that out again. They said Omicron was more mild than Delta, but it was more contagious and killed more people because it's more contagious and spreads and infects more people, and variants grow as it's wildly spreading, but it's mild. Don't worry about it. And now they're saying the same thing about this. I just can't believe it. In the US, the COVID-related hospitalizations are up 21.6% in the last week, and deaths have risen 21.4%. So
yeah, and I think we pulled. I think that clip might be a week old. I think it's around 30% now. To be honest,
yeah, I think you're
because it's escalating quickly. There's a huge panic right now. ER visits for kids and schools opening up.
Yeah. Reports of COVID-19 and ER visits from adolescents have nearly doubled over the past week. And, you know, they only ever talk about death on the news. They're starting to talk about long COVID, but all the people in power only talk about death. It's just like a cold, and they're not talking about how devastating long COVID is, and that the more people are infected, the worse it's going to be for their cardiovascular system, for their organs, for their health, right? We have
they're hiding the long-term damage. They want to pretend it's just an acute disease, and if you don't die from it in the first week, you're okay. So you get it 7-8 times, in your lifetime. We don't know what happens when you get this thing 10 times. I mean, you have a 1 in 10 chance, or 1 in.
They say every 10 infections leads to long COVID, right?
Right, and so that means benign infection, vaccinated or not, you could have a completely mild, asymptomatic infection, and that gives you still a 1 in 10 chance of developing long COVID. And the vaccine only prevents you.
But then if you,
and the vaccine only gives you a 5% level of protection against long COVID compared to an unvaccinated person.
And that clip that we showed with Fauci from this past March, I think, talking about how 60% of infections come from people who are asymptomatic or pre-symptomatic. And that's something we haven't heard of since Trump left office, right?
Yeah, and
nobody talks about it.
If Biden is here to protect the public, I mean, that should be common knowledge. It shouldn't be something that every time I tell someone that, they're like, you're crazy. No, they'd be telling us about that if that was the case. We'd know about that.
I mean, they have no idea, and they just keep talking about. Sorry, I'm just reading the. Okay, thank you. I'm going to embroider right on a pillow for myself. Nobody talks about it, and there is no help on the way at this point for people who are suffering from long COVID. There's very little research. It's been defunded.
Well, and if your kid's sick in LA, they want them to come to school. If you got the sniffles.
LA superintendent. Yeah. Come to school. And
Meanwhile,
this, he said, right. I was just going to say, that's after LA was at 48.3% positivity. He said that. Unbelievable. Come to school. And we used to close when it was 5%. And of course, as we all know, even though Joe Biden promised us that kids couldn't get sick and that they weren't spreaders, and we have a bunch of, his minions out there saying that it's no big deal, that more than 70% of U.S. household COVID spread started with a child. Of course. Like
common sense.
Yeah. So here we are. This is I'm sure everybody who is, following COVID people follows. I always get it wrong unless I'm reading it directly. WSBNBGNL. Don't quote me right there. Great account. On the left is the whitehouse.gov account saying, today, thanks to the president's swift actions and historic investments, every school in America is open safely for in-person instruction, which is, of course, absolute bullshit. School districts in Kentucky, Texas canceled classes amid surge of illnesses, including COVID. I mean, and they don't even list, like, what have they done that they're saying that it's so safe?
I didn't update this graphic.
I know. I told you. Yeah, go ahead.
But the bottom line is all these school districts they're going to act like, who could have seen this coming? Meanwhile, everyone could see this coming.
Yep.
It's clear as day what's happening. I mean, you have some colleges now starting to mask and cancel in-person classes already.
Yep.
I mean, we know this happens. We know when you have the outbreaks level that we have now, you have a serious problem on your hand you need to contain, and we're just literally letting it rip. We're literally just saying, no, don't pay attention to that. And the propaganda is off the charts. I mean, schools are short students. It's costing them tons of money. That's right. Part of the problem is the way our system is structured.
Right. In public schools, they get money every time your kid is at school, which is why they care so much if your child doesn't come to school, that they're telling people to come sick. Yeah, it's horrible. They have no plan, and yet we know that there are solutions. And because they stopped testing and tracing, we are now there's no data that people can access easily. You have to go online and find like BioBot or scientists or epidemiologists or accounts that are trustworthy who are trying to cull the data. But for regular people who, by the way, continue to say that they will mask if there are spikes, they're being completely left in the dark. So they told us, we have the tools, you're going to deal with this global pandemic on an individual basis because we have the tools. And then they have proceeded to take away every last tool at our disposal.
Yeah, and we now know that the CDC director is telling everyone to come back to work.
That's right.
No big deal. And it's all gaslighting, because if you're hearing that from her and she shows up in public and is maskless like crazy, it's a big old PR gaslighting movement led by the CDC director, who is the person in charge of keeping the public safe right there.
It's the whole job.
Yeah, but the new boosters are going to be delayed because of Biden ending the COVID public health emergency.
That's right.
So that's not good. And vaccine costs are going to be through the roof. $110 a dose for the new boosters.
Yeah. And a lot of that will be covered by the government for people who are insured. So they're gouging the government, which is, our money, which we already paid that money to develop the boosters, but Bill Gates won. Yeah. And the vaccines. But if you're not insured, 30 million uninsured or underinsured people face paying out of pocket for COVID-19 vaccines for the first time this fall because Biden ended the public health emergency. And, the biggest group of people who did not get vaccinated weren't MAGA, as much as liberals love to say that. It was people who were uninsured.
And we're talking about disproportionately people of color and frontline workers and low-paying jobs, because they're the ones going to Rite Aid to get their shot, or
who have to take off work, who don't have paid sick leave.
People.
Right. Yeah. So Biden is killing off his base. I mean, so is Trump and MAGA, whatever. But everybody knows that they're dog shit, right? Okay. What else do we got on the whole COVID thing?
Well, so obviously they're ramping up the propaganda, saying
it's more, they're even admitting it's more transmissible.
Yeah, more transmissible, but not a big deal.
Yeah, just like Omicron.
Because they have the public focused on the acute death. They have the public thinking, I got sick, I survived COVID, not a big deal. I could do that again if I have to. I could do that again if I have to. Because you didn't get long COVID and you're not disabled for a year or 2 years or 3 years or indefinitely, because we don't have a cure for long COVID.
No, the important thing is getting that economy back up and running. How many billions, millions, tens of millions did Taylor Swift make with her Eras show, which is so funny. It's the name of the new variant. Eras with an I is the variant, but I just think it's funny that Eras and Eras. But anyway,
very soon.
And you know, there is a screaming your heart out comes with some risk, because lots of people are complaining about getting COVID after they attend her concert, which is, you know, interesting where our priorities lie. The other thing
I mean, Biden, in fairness to Biden, he's doing what he can to lower ticket price surcharges.
You know, get those
That's how it
people to the
impacts.
concert.
He's trying to get more people to these concerts to kill people.
Never say he doesn't fight for the small person. Yeah, the other thing that's really interesting is, if you're wondering why they want the word COVID's never uttered in all of, you know, so many different musicians have had to cancel shows. I think this is from, Paramore. Sorry, I don't have my readers on, so it's hard for me to see. There is an exclusion for most insurance that that you cannot say that you have something that COVID, but it's communicable illness is the exclusion, right. I think. Is that what it is? It's communicable illness. What is it? Contagious. Yeah, viral. So lung infections are, okay, pneumonia, bacterial or viral, is typically considered contagious, and that is not covered by your insurance, which is why, like when Metallica, they canceled, they said they had COVID and they did not get paid out. And that's how most musicians make the bulk of their money, is by going on tour. So when they had to cancel, that's a huge financial loss, and they didn't get paid back. So that's why we're seeing now that people keep saying, you know, sorry, just not feeling great, but they will not mention that it's COVID, which works to their benefit because possibly they're reimbursed for insurance. But it again obscures the, you know, global pandemic that continues to rage in our country and all over. And so people think it's just a cold. Yeah.
But so they do more and more. I mean, we are seeing some rational thought within healthcare systems. Some of the hospitals are bringing back masks, hospitals in New York, California, and Massachusetts. You got the experts themselves, two of the top world experts on immunology and long COVID. They're wearing masks on stage.
Which matters, right? Like when you see them on stage in masks, when people take pictures with masks, that is a signal. That's a way of communicating it, which is exactly why we have, Mandy Cohn? She's the new head of the CDC.
Right.
Gave a 5-minute explainer on the new variant and COVID, and did not mention wearing masks once. There was a lot of washing your hands as the way to combat an airborne virus, but that was it.
I mean, let me just tell you, if there are lots of people out there who believe washing your hands to this day is the way you don't get COVID. I see hand washing stations all over the place. I went to the hospital cancer ward, and they had masks available on the table for people, but people were just stopping and washing their hands at the hand washing thing. Like that was the way in the cancer ward to protect people.
And probably the masks were just surgical too, right? Or were they real?
Well, they were surgical masks and nobody was wearing them. Literally nobody. Yeah. The only person that wore one was the nurse when she came in the actual room with my friend. That's it.
Amazing. Right. So, you know, and again, is this what you were just showing, that the public want, like 87% of people who were polled say that they want to mask when they think that there's a spike, but then they never hear that there's a spike. So I will say, let's hear it for, not that I should be extolling the virtue of any studios at this point, but Lionsgate did bring back mask mandates in the office. So.
And I do want to say Mehdi Hassan has never been my favorite, but he is the closest to mainstream media that we get. He's on an internet-only network related to MSNBC, but they allow him to speak a little freely on COVID. So since this is sort of as close to TV as you get, I think we should show his clip on it.
Okay.
Dr. Black, you've pointed out on Twitter that during the summer, when schools are closed, we tend to see lower child suicide rates. You also point out that, quote, school days and months are associated with the 40 to 60% increase in suicide rates for kids. Interestingly enough, though, the COVID contrarians have seemed to ignore the data, and they suggest the exact reverse, that kids get more mentally ill, have more crises, attempt suicides more when schools are closed, when even before the pandemic, you're saying vacation time showed us that wasn't true.
Yeah, and it's not just in the United States, because we have other nations in the world that have different school schedules. So, for example, the relationship between seasonality and child suicide or child suicide presentations to the ER is inverted in Australia, or has a term-based system in the UK, or in Japan follows their school schedule. So this, you had showed a graph showing this sort of steady increase of ER presentations with dips every now and then, and those dips are the summer times. But that when we hit the pandemic, if we keep drawing that graph in that study, 2020 and 2021, we see that the rate just kept increasing the way it was before. Of course, no one will deny that there's an increasing mental health crisis for kids in the United States. Suicide presentations and a number of other things are on the rise. For example, sadness, suicidal thinking, suicide rates have generally been rising. But those things had been rising prior to the pandemic, and they haven't changed that significantly since the pandemic started.
And there was our friend of show, Dr. Howard, on there. We didn't hear him talk in that clip, but yeah, I mean, every time they talk about we have to get kids back in school for their mental health, but then they don't do anything to improve the conditions of schools or why kids might not feel like they are thriving there.
And
there's just,
when you're talking about polling kids on their mental health, okay, how many kids were affected versus not being in school versus being homeschooled, where you're actually with your family more than they used to be? They're probably with their kids playing more than they used to be.
yeah.
But then the number of people that are depressed in that group, it's got to be largely from losing parents to COVID. Let's be realistic. Parents and grandparents to COVID, friends to COVID. I mean, the death from COVID, which would have been higher if you hadn't have done this, would have probably exacerbated the mental health even more.
100%. And also knowing that possibly you were the reason that your mom or dad or grandparent got sick, that must weigh really heavily also. I mean, there's a lot there. They just continue not to show an ounce of true care for anybody except for the CEOs. I mean, that's all what it comes down to, is get those kids back to school so the parents can go to work, and we will deal with the rest of it later. I don't know what's going to happen when they kill everybody off and nobody can buy their goods, but that's where they're leaving us.
Yeah.